we were incredibly happy to have been awarded gold status by the Employee Recognition Scheme this year. Just this week, we had our Trust Board agree to take a formal role in monitoring our relationship with the Armed Forces Covenant. We're also going to put forward 4 pillars of our support to make sure there's a proper framework around that. So we want to have a champion for each pillar, where there'll be recruitment, well-being, engagement and support. So in terms of veterans having a positive impact on our workforce, I'm quite biased. I am a veteran, so I'd like to think I'd had a positive impact, but we know that ex-armed forces employees are hugely adaptable, they're capable of dealing with uncertainty and change, and we're never going to see that more so than over the last 18 months in particular. The breadth of the armed forces is massive in terms of the different jobs people do. Veterans understand that, possibly sometimes the wider community doesn't. But actually the broad skills that veterans bring are the ability to cope with uncertainty, to cope with change, but then actually at an individual level, there are all sorts of things like health and safety, like risk management, all these things that veterans are trained in that we're able to capitalise on and use and make the most of. Through our People and Culture Committee, which is a subcommittee of our Trust Board, we now want to really take forward the relationship we have with the UK Armed Forces. The other thing that we'd like to do is to work with other ambulance services in the United Kingdom to work on what that broader offer is, because actually there's an NHS relationship with the Armed Forces, but ambulance services, particularly with our blue light element, are subtly different. The uniformed element of that, I think, makes us much closer to what veterans would expect in terms of camaraderie and that joint sense of purpose and connection to the front line. So I think those are things that we really want to take forward now and not just stop with gold, because I think that's very much the start. We've got the awareness now and now we want to take it forward.